Welcome back to Living in Weight. Kahu Malama Nurses is celebrating a huge milestone, 40 years of healing Hawaii. And Rob Machado, the general manager of Kahu Malama Nurses and VP of Array Corporation, joins us with more on that today. Thank you so much for being here. Appreciate it.
Thank you very much.
This is a really great thing. But first, before we get into the celebration, could you tell our viewers a little bit about Kahu Malama Nurses?
Yeah, so Kahu Malama Nurses was started in 1982 by a registered nurse who had been working for some staffing agencies, doing some hospital work, and she was seeing things that nurses being assigned to specialties or units where they weren't really qualified for or didn't feel comfortable working, and she just felt like that wasn't the right way to go about staffing. And so with that, she decided to start her own staffing agency in 1982. And so Kahu Malama Nurses was born. And so the name of the company sort of reflects what her philosophy was. So you think Kahu was a priest or a nurse,
right.
Malama helping, and then so Kahu Malama Nurses is nurses helping nurses. And that was her MO for a long, long time and continues today.
Like many others, I'm curious to know how the pandemic and COVID has kind of like put a filibuster in the whole impact of your operations.
Yeah, so initially there was a big drop in business when a lot of things closed. So we do like adult daycare centers too, and schools, all those things closed down. So that dropped initially, but then when the testing started and the vaccination started, we started staffing just immense numbers of people. There were days when we were doing 40, 50 nurses a day at testing sites across Oahu especially. If you think back to like the H3 when it was shut down, those were our nurses staffing all of that. And they did other areas and the parks and all the public areas where the mass testing took place. And then the vaccinations came out too. So we were the Blaisdell and the Pier. That was a lot of our staff.
My wife is actually a nurse, and I know that there is a huge staffing shortage. How did you guys combat that for your customers? How did you guys solve that problem?
It's been a big challenge, and it continues today. There's a massive healthcare shortage in Hawaii, but really across the country. So a lot of nurses were displaced during COVID as well, ones who were working in doctor's offices or, there was no elective surgery during that period as well. So a lot of them were looking for some other gigs in the interim. And so we recruited them, and these were good jobs that nurses liked doing. A lot of them, some came out of retirement to do too, or were working part-time, because they wanted to serve the community, and that's what nurses like to do.
Who are some of your customers? I know you mentioned a couple, but who do you guys work for?
Yeah, so we work with like all the major health systems in Hawaii, HPH, Queens, all the big ones. And then we have a lot of smaller clients too that we service. So we did a lot of the testing services for a company on the mainland who had a contract here, and then we did the vaccinations, like I said, with Queens and HPH.
Everything's pretty much opened up now. What's next for you guys?
So we're growing pretty immensely. So last year, just about 1 year ago, last October, we were acquired by another company, so now we're part of a national company.
Okay.
And so we're actually expanding our travel nursing division pretty immensely. Previously, we focused just on Hawaii, bringing nurses to Hawaii, and we're still doing that. But now we have a national reach, so we're also trying to reach nurses on the mainland, place them there, but once they're done with assignment there, bring them to Hawaii, because Hawaii will always be our base. That's our main focus. We want to support the healthcare shortage here as much as we can. Let's
give our viewers some info. How can we find out more info about you guys?
Yeah, so we have a website, kahumalama.com. You can just Google that. You can get lots of information about us. There's contact information. We're constantly hiring for nurses and nurse aides and medical assistants. We're developing programs to help train up lower level nurse aides and medical assistants to move their career up so they can get certified, and we'll help them if they want to become an LPN or RN. We're trying to develop training programs to help them move up in their careers.
Well, thank you so much for being here. I really appreciate all the info, and I'm sure some of our viewers do too. And of course, we'll have that information on our website shortly after the show. Rob, thanks.
Thank you.